Hi, I'm Dr. Clint Witsman at Champion Fitness Physical Therapy in our Pontiac clinic. Today we're going to be talking to you about our traction unit that we have in our clinic here in Pontiac. A great alternative for treatment of low back pain and cervical pain, because we can use it for both. We'll explain to you how it works and what it actually does for you and how it can affect your spine and help decrease your pain. I'll go ahead and I'll show you the unit here first so you can see what it looks like. Pretty nice soft table. The table moves up and down, so if you're shorter we can get down to there, and if you're a lot taller we can bring it up to make it more comfortable for you as we get you hooked up. Really, traction and decompression tend to be a very interesting thing in the therapy world right now. In all honesty, they're a lot of the same thing. They do the same things. They help with low back pain in the same way. It's just they're just look a little different. So they're mainly the same thing though. So I'll show you here on this model what decompression does actually in the spine itself. You can see here from the side that we have vertebra, which are just bone, that are separated by discs. And you can see these little yellow things right here are nerve roots that come out of your spine. Looking at your spine from the back, you see that we have some joints that connect our vertebra together. You have to forgive my model, it's a little old, but you can see those joints right there where my hand's at, pointing to you right now, how that comes together. Okay. What happens is as we get older or younger, if we fall, our spine compresses and everything gets pushed together just from over time, not necessarily any trauma or an accident, but it just starts to compress. And what spinal decompression or traction, which is what we're talking about today, does is it actually will pull that apart a little bit. All the tissue around the spine, on the front and on the back, will get a nice little stretch. If there's any muscle spasm or compression of a nerve root, it will help stretch those out so that hopefully if you're having some pain down your legs or you're having pain into your bottom, that we'll see that get better. It can also just help you feel a little bit better so that the other treatments that we use, like core strengthening or stretching of your muscles or your hips, can be a little bit more comfortable for you so that you're not having as much pain, just making you feel better. So, there's only a few things, honestly, that we can't use traction for when it comes to the low back or the neck. The main thing is if you've had a fusion and it's within the last year, we can't really use decompression or traction for that. But if it's been longer than that, it's definitely a possibility. We just have to get that clear from your physician. As you're going to see here in a couple of minutes, the setup's pretty easy, pretty comfortable. That's the important part about traction or decompression, is that when you're on that table laying there and it's pulling on you a little bit, that you're comfortable and it's helping decrease your pain. Because that's why you're coming to us, is to get you better so that you can get back to your normal life. If you have any questions or anything, please don't hesitate to give us a call. We love the traction table. We like to talk about it and educate our patients and possible patients about it. So just give us a call and we'll be glad to help you out. As we're getting ready here, I'm going to have Kristen Eggenberger be our demonstration person. I'm going to hook her up so you can get to see what that sort of looks like for your lumbar spine. But don't forget, we can also use this for your neck as well if you're having some neck pain. Alright, so here's the traction table as we've already shown you. We already have it pre-set up. What Kristen's going to do is she's going to lay down on her back here. So Kristen, please lay down here for me on your back. The hardest part is getting the belts on. Once we have the belts on, it's all easy. So I just have to palpate Kristen here, find where I want the belts. Go ahead and put your arms up overhead for me. Good. A lot of people don't like the tightness of the belts, but the nice thing is with this unit, we don't have to have it too tight. It actually can be fairly loose. So that's the nice thing. Kristen, how's that tightness-wise? It's just snug, right?
Yep.
Yeah. So it doesn't have to be too tight. So if you're a little claustrophobic, this shouldn't bother you too much. You can see right now I'm putting on the lower belt, which the traction unit will actually pull on to help separate those vertebra and help everything to get a nice little stretch and hopefully help the patient feel better within a couple of treatments. So there we go, Kristen. Good. Hands back up overhead for me. The upper belt, same thing. Doesn't have to be too tight, so we just make sure it's nice and snug. Kristen, go ahead and breathe out for me. Good. And then we just snug this down just like that. And you can go ahead and relax. We'll give Kristen some pillows here. Like that. Go ahead and bend up both knees for me. The cool thing about this unit is that we can do traction on your back like this. We can do it laying on her belly, or we can do it laying on her side. So we can find a comfortable position to make everything more comfortable for her so that she can tolerate it a little bit better. So pretty simple. All we're going to do is just hook this loop to that. Like this. Then we'll hook the traction head, which is what actually does the pulling, up to Kristen. So we're just going to pull the rope out here, connect it to the belt, and then take up all the tension. Good. We can raise and lower the table depending on what angle of pull we want, if we need to adjust that. Kristen, are you pretty comfortable right now?
Yeah, I'm good.
Good. And that's the point of traction, is to be nice and comfortable. I have a button here that I'll give to Kristen. If it starts to hurt, or if something's not going right, she just doesn't feel good, or she feels some claustrophobic, she can hit that button, everything will stop, the buzzer will go off, and we'll come back and find out what's going on and hopefully help her get more comfortable. Traction is a great way to help treat just about any low back issue. There are a few exceptions, but for the most part, we use it with just about all of our low back patients that come in. Pretty good success with getting them feeling better early off, so that we can start the strengthening process a little sooner than we would if we didn't have the traction table. So it definitely is a big asset, and definitely can help out with just about any low back problem. So please feel free to give us a call if you have any questions. We're here for you.